Hello, fellow occupational therapy students. Today, Kirsten and I will be presenting on a cognitive assessment. We will be discussing the Dementia Rating Scale-2. This is also known as the DRS-2. This is an updated version of the Dementia Rating Scale.
The main author of the Dementia Rating Scale-2 is Steven Mattis. The professional manual was written by Paul J. Jerica, Christopher L. Layton, and Steven Mattis, and the alternate forms were written by Kara S. Schmidt.
The DRS-2 was published by Psychological Assessment Resources, PIR Incorporated, located in Lutz, Florida. The instructory kit with manual, 50 scoring booklets, 50 profile forms, and one set of stimulus cards costs $484, and the professional manual costs $158.
This assessment collects normative quantitative data and is a standardized test. This means that the data collected is matched against data from a healthy population of the same age group. The DRS-2 was created to be age and education corrective as well as user-friendly.
The purpose of the Dementia Rating Scale 2 is to measure the mental status of adults with cognitive impairments, differentiate different types of dementia, and also contribute to the growing understanding of the neuropsychology in older adults.
The DRS-2 assesses the OT domain of client factors, namely the overall level of cognitive functioning, specifically in the areas of attention, initiation, construction, conceptualization, and memory, all of which can affect occupational performance.
The population being assessed are older adults that exhibit cognitive dysfunction. The age range is 56 to 105 years of age. This assessment will not be effective with older adults in the age range who demonstrate no cognitive or brain dysfunctions.
The DRS-2 is administered verbally and consists of tasks corresponding to the 5 cognitive functions being assessed. Attention has 4 tasks, initiation has 11, construction has 6, conceptualization has 7, and memory or attention has 9 tasks.
There is a scoring booklet included in the DRS-2 kit, and at the front of the scoring booklet is a summary table that describes how to score the assessment. There are different sections that score the raw scores, the age-corrected scores, or the DSR-2 total scores, as well as the age-corrected and education-corrected scores.
According to the official Dementia Rating Scale 2 website, it can take anywhere from 15 to 30 minutes to administer the assessment and about 12 minutes to completely score the assessment.
The test materials required and included in the introductory kit are the professional manual, individual scoring booklets, and 32 stimulus cards. These items can also be downloaded digitally. Additional materials required but not included are timing devices, pen or pencil, and a clipboard.
According to the Dementia Rating Scale 2, the only space requirements are 2 chairs and a table. However, some recommendations include a quiet, comfortable environment that is also clutter-free.
According to the DRS-2 professional manual, individuals trained and supervised by a qualified psychologist may administer and score the test. These individuals should be at the qualification level B, meaning they have a degree from an accredited 4-year college or university.
The DRS-2 is intrinsically age and education corrected to ensure normativity. There have also been studies to assess racial, age, education, and gender bias, and no bias was detected. However, there is a level of language bias primarily among non-English speakers.
The test-retest reliability of the DRS-2 total score received a correlation coefficient of 0.97, and the validity studies all demonstrated a strong R score. These validity studies included factor analysis, construction validity, and clinical validity, which tested populations with dementia as well as other neuropsychiatric populations.
The DRS2 professional manual encourages the use of a clipboard to shield the scoring booklet from the participant's view, and the testing area should be calming with adequate light. If these needs are not met, the test's validity can be affected.
The DRS2 assessment was designed to present the more difficult tasks first, which can shorten the time of the test if the older adult correctly completes the first 2 or 3 tasks. Examiners should also practice several times before solely relying on the scoring booklet to prompt them.
The DRS2's strengths are that it is a highly tested, normative, standardized, cognitive assessment with high reliability and validity. Its weaknesses are that it has a language bias for those with severe dementia.
There are 2 similar cognitive assessments for older adults that assess similar dysfunctions and levels of dementia. They are the Montreal Cognitive Assessment, or the MoCA, which we have all recently been certified to administer, and the Clinical Dementia Rating Scale.
The DRS2 has grown in significance as the older population has increased as well. Dementia affects all aspects of occupational performance with emphasis on ADLs, IADLs, health management, and social participation. The DRS2 can be a critical tool in narrowing down the occupational needs for the older generation. Thank you for listening.